we were excited for our first ultrasound, and then we get the news back that, there's issues with her stomach and something was noted. And so then instantly it goes from excitement to nervousness, emotional, scared, all in one breath. And then when we find out how this procedure is going to go and how in-depth it is and complex and just everything, it was just like, oh my, this is just not going to be a normal pregnancy delivery again. So it was quite the pregnancy. Go from excited at one that our baby's finally going to be here, but yet scared to death because we don't know what's going to happen. And so it was just a very scary thing. And then to find out how this procedure is really going to go and how it ended up, and all these people that were in my operating room, and it was just like, okay.
The risks to Haylee are significant. When an intrauterine ultrasound shows an oral mass like this near the airway, the risks of delivering the infant with, say, a vaginal delivery in a regular labor and delivery room are high. Once the oxygen source from mom, the umbilical cord, is cut and clamped, then baby really has to switch almost immediately to getting oxygen through the nose and mouth. And in Haylee's case, we were very concerned that this mass was obstructing one or both of those pathways. And so we came together as a team of physicians with a lot of other people that were present besides the people that are at this table to plot out the best way to approach Haylee's delivery and resuscitation, and we determined that that would be by this exit procedure. We proceeded with a cesarean section, and the maternal fetal medicine team was able to partially deliver Haylee and delivered just her head. The important thing about that is, again, she's still getting 100% of her support from mom, simply like she was 10 minutes ago when she was in utero. So that gives us as a medical team focused on the infant time to get an airway and a safe way to ensure that she's getting oxygen. If she hadn't been born under these controlled circumstances and there was a delay in getting the airway established, Haylee would have been at risk for things like cerebral palsy, developmental disorders, and possibly even death if we weren't able to get an airway in a timely fashion. So the risks were very high to both mother and baby, and that's why we took this case so seriously and went to these great lengths.
Again, I want to stress to everyone that this is an exquisitely complex procedure, just in the amount of individuals that had to be involved with this and the degree of coordination that had to occur before the baby was born for this to happen.
Dr. Lusk was able to establish an airway, and he's going to talk a little bit about that. I was involved in helping positioning the baby and positioning the jaw so that he had the best possible exposure for that airway. The airway was then established nicely. We were able to deliver then her arm and a little bit of her chest so we could do some more monitoring of her vital signs while we secured the airway. And after the airway was secured and we knew she was stable and doing well, then she was delivered completely. The cord was clamped, and I took her to the operating room right next door so that we could continue to assess her and see what her medical needs would be.
The mass itself was, as you know, a teratoma, and it was located in the roof of the nose, basically at the base of the skull. And Dr. Miller and I removed the mass in the operating room about 4 days later. It came out nicely. Once you can visualize the voice box and put the tube in, then you know that things are going to be fine in terms of the airway management and the rest of the delivery, because we have the baby's airway controlled at that point and we can deliver oxygen. So that's the most important thing. And in terms of the sequences that we were going to have to go through to make sure that Haylee was adequately oxygenated, stopped at step 1, and it just doesn't get better than that.
I think it's important to point out that this all began very simply, like we would hope every woman would begin her pregnancy, which is with good prenatal care. And prenatal care is really what saved Haylee's life. And all of this and everything that happened both on the day of delivery, the weeks before delivery, and throughout her hospitalization is because Haylee's mom sought prenatal care.
It was just a great experience, but yet just glad it's over and everything turned out the way it did. And you know, it took great doctors and planning to get this all handled and made it smooth as butter. So
Our hats off to all the surgeons involved. Went really smooth, and they did their job as well as they can. So everything went good. We're pretty happy with that outcome.
yes, everything's been going good, and we're just anxious to get her home and start our complete family.